everyone, welcome back. My name is Jaylin. I'm an RN BSN, and today's video, I'm going to be giving you 10 tips to help you with that job interview coming up. Now, I have used these tips in all of my job interviews, and I have gotten every job that I have applied for. So I hope that you can use either some of these or all of them to help you nail that job interview and get that job you are applying for. So let's get started. Tip number 1, do your research on the healthcare organization. This is very important. Whether it's a hospital, a surgical center, a clinic, a home healthcare agency, it is very important to do your research and know a couple of facts about the healthcare organization. And it will make you look better in your interview that you are ready for that job interview and you're not going in clueless and it doesn't look like you don't care. It's very important to have these facts on hand, whether it's knowing how many beds that the setting holds, or knowing their COVID rates, or knowing anything important about that site. It gives you a better look during your interview and it shows that you care. Tip number 2. Hair and makeup and grooming. You want to look the part. Now wait, you're gonna say, why are we talking about hair, makeup, and grooming? It's very important and no one seems to talk about this. When I go into a job interview, I literally make sure I am looking the part and I am groomed, I am clean, okay? No one wants a person that looks like they just rolled out of bed, who doesn't keep themselves put together in a clean, sterile environment. Am I right? So for girls, the top 3 hairstyles that I choose are a sleek back ponytail, a low bun, or a good half up, half down style. Okay, you don't want crazy curly club hair or anything that's in your face. Just keep it nice and clean. For makeup, concealer, a light foundation, blush, minimal eyeshadow, a little bit of lashes if you prefer, or no lashes at all, and some chapstick or something, on your lips, a nice light color, just to make it clean. And if you need help with this look, on TikTok and Instagram, there are tons of clean girl makeup tutorials that will just make you look beautiful and formal. For grooming, for our men, we want either a nice shaven look or something that is well groomed. As for a hairstyle, make sure you just got a haircut. Also, moisturize that face and, put some chapstick on. It does not hurt. When you walk into that job interview, they look at your exterior first, and then they look at the interior when they start asking you questions and when they start to get to know you. So we really want that exterior to match what a great nurse you are interior, okay? It really makes a difference. Tip number 3. What do you wear to a job interview? My main tip that I always do, wear your nursing scrubs. You are there to apply to a nurse's position, so why wouldn't you wear your nursing scrubs? They say wear fancy business casual. Half of us don't even know what fancy business casual is, correct? It's not like we're coming from a previous nurse desk job or a bank job. We're straight out of nursing school. Just did our, just did 2 years of nursing school. All we have is scrubs. Wear your scrubs. When you walk in, they can already envision you as a clean, groomed nurse, and they can kind of envision you on that unit as a nurse. That helps you out tremendously. If I were to walk in, with a blouse and some trousers and some high heels, I feel that I'm not really authentically me as a nurse. I wouldn't be wearing heels on the floor. So I want to come in giving them my best nursing face and outfit, and that is my scrubs. All right, tip number 4. I always get to my job interviews 30 minutes early. Now let me break it down. The first 15 minutes is where I park and I walk to my job interview location. That means finding the office, finding the building, especially if it's at a hospital. It's a little confusing. You might have to go through security to check in. So that already takes up 15 minutes when you initially get there. The second 15 minutes is you have already wanted to be checked in with whoever you're checking in with for your job interview. If your job interview is at 1 o'clock, at 12:45, you should already be checked in and waiting in that seat for someone to come and get you for your job interview. This makes you look on time, like you care, and like you're well prepared. If you are not early, you are already late. Tip number 5, be yourself, but be your best self. And what I mean about this, be happy, feel good, smile. This is important, even with the first interaction you have from checking into that interview. That first person that checks you in or has interaction with you, word will travel about you. If they feel that you're not warm, you're not kind, you're not nice, they will let the other nurses know, or nursing administration. Trust me. So the minute you check in, have a smile on your face and be welcoming. During that interview, be the best nurse and best person that you can be, and which you are. Make sure you show that and smile. Don't sit there like a robot and answer all the questions perfectly and show no personality. Smile, be lighthearted, be fun. Remember, that's what a nurse is about. Your patients want to feel cared for. They want to feel a warm, welcoming, and loving nurse, and that's what you should show in your interview as well. Trust me, it goes a long way. Tip number 6, your resume and what forms or certifications to have for your job interview. Now, for your resume, I always have 2 copies on hand with me on a nice piece of paper. Don't have stains on your paper, don't have it crinkled up. And even if they have a resume from, let's say, Indeed already, still have 2 forms. You don't know if they lost it. You don't know if you're gonna have more than one person interviewing you. And what if you applied for that job months ago and it's not an updated resume? Always have 2 copies. This is what has helped me. Now, forms. I will list a checklist of forms up here that you should either have on your resume or you should have separately. This includes your COVID vaccinations, your flu shot, your ACLS, your BLS, and your nursing insurance, okay? And then I'll list a couple more. But those are things that if you already propose it to them and show them that you have everything, this will make the hiring process easier for them. They don't have to ask, they don't have to wonder. So it helps you out to make their lives easier, more of an incentive to hire you for that position. Tip number 7, be prepared to answer questions. Be prepared. If you are not prepared, you will fail. They will always ask you questions, so already have a rough draft in your mind or a piece of paper that you have rehearsed to answer these questions. Now, usually the top 3 questions that the interviewee will ask you are, tell me about yourself. Can you tell me about a work experience? And what would you say the greatest faults are? Now, of course, there are more, but these are kind of 3 questions that they will always ask you. Now, for the tell me about yourself question, make sure you kind of have a couple bullet points about yourself that you have remembered, because trust me, when you're on the spot, all of a sudden you're nervous and you can't think of anything about yourself. So have 3 or 4 bullet points about yourself to show that you are a strong, capable nurse. Now, one of my strong points that I always let them know in an interview is I am a quick learner. This is very important. If you're applying to a job where you don't have too much experience, letting them know that you learn quickly and effectively gives you a better job at that position. For the question, can you tell me about your work experience? If you don't have much work experience or you're a new grad, draw on those clinical experiences, okay? Let them know, when I was in my clinical rotation, I worked or I helped out at so and so, and give them a couple examples so they know that even though you don't have work experience, your clinical experience is strong and it will carry over into your new job. What are your greatest faults? Don't let them know your greatest faults. No, I'm just kidding. What I say when I have my greatest faults is sometimes I overwork myself and I try to do too many tasks at once. Now that lets them know that you like to work hard, you're involved, you're driven, but sometimes I like to take on more than I can handle, and I have to slow down, give myself a little grace and kind of manage everything so I can have the best outcomes and obviously best patient care. Tip number 8, make sure you have questions ready to ask. When they are done questioning you, they will always ask you, do you have any questions for us? Yes, you do. I always ask about 2 to 4 questions that are related to that specific job position. This makes you look like you care, that you are well informed, and that you want to have the best knowledge about this location. So it's also a job fit for you. So make sure you have 2 to 3 questions that are lined up, mental note in your head that you are ready to ask. Tip number 9, pay range, start date, and how much you are willing to work. Have your pay range set already, okay? And always aim a little bit higher, even though you think, well, I'm a new nurse, I shouldn't aim that high. Always aim higher, because a lot of the times they will always aim lower. So if you give them a higher number, they will come a little bit low the higher number instead of the lower number. Very good tip. 2, have your start date ready and in mind. If they ask you, what is your start date? And you're, oh, I don't know, well, maybe. No, have it ready. They want to know when you can start working, because there is a nurse shortage. So to have that date is a more incentive to hire you. Also, if you have any trips coming up, or say you want to start next week, but the week after you've already had this vacation planned for a month or 2 months or a year, let them know it is important, because you don't want to get hired on and then all of a sudden you can't work. The next tip is let them know if you're going to work full-time, part-time, or per diem straight off the bat. They don't want to play any games. They want to know when you can work and when you can start. Have all this information ready to go. Tip number 10, our final tip. After your interview, get a business card from them. If they do not have a business card or they ran out, ask for their email, because the following day you will want to send them a thank you email, thanking them for their time, and also letting them know that you look forward to hearing from them. This is important. I always do this no matter what, and it helps, because they probably had a couple job interviews with other people after you. So you sending that email makes it look like you're putting an extra foot forward to get this job position. And it is also reminding them of you, which is very important and very crucial. All right, those are my 10 tips that I have used in every job interview, and that I swear by, and have gotten me where I am today, and has gotten me every job interview I have applied for. And my key takeaway is fake it till you make it. I know it sounds crazy, but it's the truth. If you go in lacking confidence because you're a new nurse, or you haven't worked in this specialty, or you feel like your nursing skills aren't up to par, if you look and act like you know what you're doing, eventually you will. Just act confident, be confident, and fake it till you make it. And trust me, it will go a long way. Thank you guys so much. I appreciate you guys. If you have any more questions, leave them down below. Like, comment, subscribe, and I'll see you in our next video. Bye.